Hi everyone, I just wanted to give a quick overview of the depression and suicide assignment that's going to be due October 24th. I asked you last week to start looking it over. We covered the content that is related to it in last week's lecture material, but just wanted to give a brief overview and discuss the assignment so there's just a little bit more clarification. So if you go under our mental health course, go to lessons, content, you will find it under assessments, and you're going to choose assignment number 1. So here you will find the assignment instructions, the rubric, which is going to show you exactly what I'm looking for and how you get your marks or how you lose your marks, a sample title page to start your assignment with, and then this is the drop box. The other thing I've put in here, because APA will be a part of your mark, is all these APA references. So the first two you might recognize from clinical. The rest are videos, and I don't know if this is a better way for you to learn how to do APA, so I've just provided those. They are all 7th edition. I find that students have a hard time with it, so please make sure you are reviewing this carefully. I will be looking at everyone's APA, and if it is not formatted the way the APA reference book says for both in-text citations and the APA reference page, you will lose marks for that. So please make sure that you understand it, get help from a tutor if you need, and review these resources. So if I go to look at the assignment, if I click on this one right here, this is how it's going to come up. So it is going to be submitted in APA format, and you would submit it to the appropriate Dropbox using Turnitin by Sunday, October 24th at 23:30. It needs to be properly formatted with an APA title page, which again, I gave you a sample one, so everyone should be getting that perfect. It just needs you to put in your own specific information. Each question, there'll be a paragraph answering each question. You also need at least one scholarly research article less than 7 years old, or one appropriate RNAO best practice guideline. So what I mean by that is it has to be in relation to the topics of either depression or suicide. You can't have something about catheters. I would allow something about therapeutic communication, but it would have to really link to what you're trying to answer in the question. I've given a few examples already in our lecture from last week, and in the week 5 module you'll find something, but please know that there's other ones out there. You need to paraphrase your answers from reputable sources to answer the questions with appropriate use of in-text citations. So if it's not your own ideas, if you didn't come up with it on your own, you need to put an in-text citation or it will be considered plagiarism. Please only use direct quotes if necessary, and I'm telling you guys, you should, if you're using direct quotes, only have one in the assignment. I would really suggest that you paraphrase everything with in-text citations and avoid direct quotes. All references are required to be from scholarly resources or scholarly sources. So things such as Wikipedia, Nurse Labs, WebMD are not going to be acceptable. Textbook is allowed, but it can't be the only source of information. So again, this is why you're going to need at least one scholarly article or a best practice guideline. Marks will be lost for errors in spelling and grammar, and properly formatted APA reference page as well. So everything that is cited in your body of your work needs to have an appropriate APA reference. So if you used 5 different resources in your body of your work, I should expect to see 5 correctly formatted APA references in the APA reference page. So for part 1, this is where I want you guys to delve a little bit deeper in depression and suicide, because it is something that you guys as nurses and as individuals in society are going to come across, and I wanted to delve deeper into this topic more than what we can in class. So for the first question, you're going to look at what the potential causes of depression are, provide 4 potential causes with examples of each. You're going to define and describe 2 main signs and symptoms of depression. And again, we went over this in class, so you should be getting the 2 main signs and symptoms correctly identified. As part of your answer, include one understanding of one depression measurement scale used by Canadian nurses, what criteria it assesses in a patient, and what patient population it uses. So find a depression measurement scale. It needs to be used something that Canadian nurses use. You need to tell me what kind of criteria. You don't have to tell me every single question, but what are the things that it assesses in a patient, and what patient population is it meant for? So you might choose to focus on something that's more related to children. You might choose something that is more specific to young adults, but you need to identify, because again, not all measurement scales are created equal and look at the same things in all different populations. You're going to define 2 non-medication treatments for depression, describe how they work, and any key nursing responsibilities or education required to provide to the patient. So besides meds, what kind of treatments are out there? What kind of therapies are out there? And if you pick these things, what are your responsibilities as a nurse? What do you have to do? What do you have to monitor? What do you need to educate the patient on, either before, during, or after? Make sure you're very specific, not vague. The more vague, you could lose marks, because then you're not demonstrating to me that you know exactly what it is that your nursing responsibility would be, or your education would be. And number 4, you're going to define 2 classes of medication for depression. Describe their mechanism of action. So again, how do they work specifically? And provide 3 priority patient health teachings related to each medication. The key is 3 priority. It's not just pick any 3 things to teach them. It's what, if you can only teach 3 things, are the most important for them to know. So as it states in the question, be specific in your health points to demonstrate you know exactly what you would teach them should you have a patient started on this class of medications. So make sure your teachings are very specific to show you know exactly what to teach. So then we move on to the point that is related to persons who experience risk for suicide. So again, you're going to write in paragraph form and be descriptive and use examples. You're going to describe 2 suicide assessment tools used in Canadian practice to assess the risk of suicide, including the criteria it assesses for and the patient population it should be used to assess. I gave a list of the 3 most common in class, and you can also find that in the textbook, so that would be a good place to start. And then again, you want to just tell me the criteria. I don't want to know every little question, but what are the things that it looks for? Put it in your own words, and then tell me which patient population it's meant for. Number 6 is you're going to define 3 protective factors or characteristics that make an individual less likely to consider, attempt, or to die by suicide, and provide specific examples of each. Again, we're so used to looking for risks. I also want to develop your ability to see what kind of things does the patient have going for them that will help us protect them, and what do those look like. Number 7 is describe a safety plan and a no suicide contract. So you'll explain what one is and what the other is, and then you're going to explain which method is recommended over the other and why. And to get the full marks, it's not just saying which one's recommended, but being able to have the correct answer of why it's considered better than the other. And then 8, you're going to make a sample safety plan for your patient. Make up a fake patient. List the components of a safety plan as described in your textbook and provide 2 specific examples of what could be included in each section. So you're going to have all the different components of the safety plan and then tell me 2 examples of each component. And then finally, you're going to make sure that you have really good spelling, grammar, literature, and APA. So you can lose marks for your writing style, your grammar, inappropriate use of literature. So what that means is you only use the textbook, or you use WebMD, you use Nurse Labs, you use something from not a reputable source. And if you're not sure, please send me an email with enough time for me to respond before it's due. But you should be using appropriate websites. Maybe it's going to the Canadian Psychiatric Nursing Associations. It needs to be things where people know what they're talking about. And then APA. So again, your in-text citations are done properly, as well as your APA reference page. So that's your assignment. The next part is the rubric. So this would be showing you where and how you're going to get or lose your marks. So I suggest read this before you start, and then after you've written your assignment, come back and check and make sure. You really should be answering yes to every question, or when you review your assignment, did I do all of these? Because that will ensure that you've got the full marks. And please make sure that you've come here to see where you're going to lose your marks when it comes to writing style, APA, use of literature, and spelling, so that you get the max amount of marks possible. The sample title page, like I said, makes it super easy. Download this as a Word document and put your name in it and the date. Literally everything else has been done for you. And then what I would do is just use this Word document to continue on to do your assignment. Make sure you submit everything as a Word document. And then, if I go back, you've got your Dropbox, your APA guides, and I just wanted to quickly show you how it should look like without you being able to fully see. But it should be, I can't show you because the student's name is above, so for privacy you won't see that. But this is really what it should look like. Don't want to show you, or I can't stop for too much because I don't want you to be able to read. But that is how the assignment is supposed to look when it's done. So if you have any questions, please make sure after the midterm, because I'm sure no one's thinking about it right now, that you have a good look. If you have any questions, you reach out in a timely manner so I can give you the answers, and you get this assignment done before October 24th.